The Love Hour.
You're doing it back here.
Take one. This late.
That's what happens when you do the most. Hello, everybody. Welcome to the Love Hour podcast. I am your host, MrsKevOnStage, and KevOnStage is noticeably missing because we are putting the grand finale on our For Women Only series. Thank you guys so much for the awesome reception that this series has had. It's brought me great joy. And so we are closing it out today, this week, with Dr. Jessica Shepard. Yay!
Yay! I'm so glad I got to make it. I
Yes,
was so excited
me
when
too.
you reached out.
Oh, I'm so excited to have you. I literally was talking to Dr. Shepard, 2 or 3 days ago, and I was like, I feel like I hit the jackpot with the guests that we've had. I feel like I don't know any other better guests that I can get than
and I know
what
them,
I have
I think
this
they're
year.
phenomenal too. They are amazing women. We connect. I know Dr. King really well, and I feel like we have this task or this mission to empower women in their health, and so I'm glad that we have this platform to do that.
Oh, I'm so excited. That's all. Everything that I'm about is most definitely about empowering women, empowering couples, but empowering the woman within the couple.
Yes.
And our health is no exception to that. So I'm so excited. Thank you so much for joining us. So tell the people a little bit about yourself, how long you've been practicing, where you live, your personal mission, all of those things.
Yeah. So I'm Canadian. First things first, yes, everyone take a gasp. Yes,
I
Canadian,
didn't know that.
Born and raised. And my parents are Jamaican, so that's always, if you're from Canada and you're black, you're usually from the West Indies. So that's a note. But Jamaican background. But I think being an OBGYN, what really drew me to it initially was babies. Oh, the babies, they're so great. And then I realized they don't really have banker's hours. So
They showed up.
But I love being in the OR, so that's what pulled me to the GYN side and women's health. And just like you said before in the intro, empowering women in their health, that is like my main mission. That is my passion. That's what I spend most of my time, whether it's in the office or I'm speaking or doing TV or doing podcasts, is allowing women to find that space where they feel empowered to do better for themselves in their health. Because it's like they're the nucleus of their family. So if they can start that legacy with them, then it's like that ripple effect. They can make it go through. But I did do a surgical fellowship. So that means after residency, after the 5 million years that we spend in school, I did 2 more years in just surgery because I really found that I could be powerful in the operating room. And I use that to be able to help women with their conditions. And most of them are fibroids. So we'll talk about that today. But I found ways to do surgeries that were innovative. And we can talk about some of those features throughout the podcast on how to give women their best outcomes surgically and not necessarily have to do big incisions and scars. And so that's where I spend, I would say, most of my time in the office. When you think of like my clinical practice is a surgical gynecologist, and then also menopausal and sexual health. I love talking about sex.
We gonna get there, child.
Talk about it enough.
I agree.
We think it's taboo. We kind of put women in these boxes, like you adolescents, especially in the Black community. Your adolescents do not have sex.
So true.
Right? And then they're like, get married and then we want you to have babies. And you're like, but you realize you have to have sex to have the baby?
Bingo.
And then after kids, when you're going through menopause, then they're like, oh, well, all right, well, thanks so much for showing up. I mean, like that sounds like the worst sexual history ever. So I hope that we get to talk about sexual health today.
That was awesome. And I'm excited because, yes, everything you said, I just want to say yes.
You're like,
yes,
check,
yes,
check.
Yes, yes. Yes. So what we're going to do with Dr. Shepard, of course, is cover basically like the potluck of questions that we receive. And I tried to group them so at least we have some sort of order. And then they were the most asked questions, so to speak, and then we'll get into the sex questions because those were absolutely
we'll interject them here or there just so people are not too uncomfortable so they don't get sweaty all at once.
Yes. I love it. Okay, so I'm super excited. So let's dive right in.
Let's do it. Let's do it.
So we're going to start with fibroids. overwhelmingly,
Yes.
this was the number one question that I
Yep.
received was about fibroids, which was interesting to me because I was like, well, what the heck are they? Like, I had to kind of do my own research with
So
them.
you felt when you were reading the questions that you were like, oh, like kind of, I don't know that much. Maybe I've heard of it.
Yes.
Which I'm so glad that you said that, because obviously if I deal with them every day, when I hear women say, I've never heard about that, in my head, I'm like, really? So that I love that you were able to share that.
There
So
were
women
so
do not
many
feel
questions.
like you are alone if you
And
don't know
know.
what it is. Yes.
Definitely. Literally, I was like, I need to educate myself because this clearly is an issue.
Oh, yes.
That women face and I could potentially face. So let me educate myself. So I had to do my own research. So for those women who are in the same boat as me, tell us, what are fibroids?
If I could like simply put it in like a paraphrase sentence or two, it is the most common benign. So benign means it's not cancerous. So it's not cancerous.
Okay.
It's the most common benign tumor of the pelvis. So and that's why I like to start it out that way, is that it's the most common. So when women are diagnosed with it, they don't feel like, oh my gosh, I'm alone or I'm like an alien because I have a fibroid. Listen to the statistics. By the time women across all races are 50% will have fibroids.
Wow.
African American women, listen to the number, how it jumps. 75 to 80% by the time they're 50 will have fibroids. Right? So when we think of that number, it's like, wow, that's an astounding number. But what we do as clinicians is help women understand, yes, 75 to 80% of women, African American women, might have it, but you have those who have symptoms and those who don't. Is for women to know if they have a symptomatic fibroid.
Okay.
Those are really the ones as a physician that we really pay attention to help you through that symptomatology. But if you get diagnosed with fibroids, you may not have to do anything at all.
Gotcha.
And so I really want women to understand, yes, so many women have fibroids, but we really focus on the ones that are tampering with people's lives.
Got you.
Yeah.
So what are and I loved your definition, and actually I felt hopefully you guys did too, like oh, okay.
Yes.
Like, oh, it's common.
Yes.
Oh, it's benign. Oh, you could have symptoms and not. Like, every time it was like, I released a little bit of like, oh, anxiety.
Because it's like this one word, it's very inflammatory, like, oh my God.
Yes.
And then we're like, no, let's get you to the place you need to be as far as comfort and reassurance, because one, you're not alone.
Right.
But two, we can deal with this.
Got you.
Yeah.
So tell us about the fibroids and its effect on our lives. What are the symptoms?
Yeah. So the most common symptom is very heavy bleeding.
That's the number one thing people are talking about.
And that's usually when women come into my office, when we ask about their cycle, oh, it's really heavy. And I dig a lot. So that's my job, is to be like an investigator of your health. And so I'll say, well, how heavy? And how many days? And how long have you been dealing with this? And what I find is that women, which is very, very symbolic of what women do, is like we are so busy taking care of everyone else, we're not taking care of ourselves.
Amen.
And so they'll be like, oh my God, yeah, I've had 3 blood transfusions. This has been going on for about 10 years. And I'm like, ma'am. So, it's like, let's sit here. Now you're not leaving until we figure out a solution. But it's usually heavy bleeding. And when you dig, you're like, wow. But if you think about it, many women, as they start their cycles, are told by their mothers, grandmothers, aunts, whoever, oh, this is normal. Right? So we normalize it. So then they're like, oh, okay, this is normal. This is what I'm supposed to go through.
Right.
I'm not necessarily going to highlight it to my doctor that this is a problem, or sleep with the plastic sheet on my bed when I'm on my cycle, or I always bleed through my clothes. Or, for example, there's a foundation called the White Dress Project, because it's highlighting when people are on their cycle, they will never wear white. Right?
Amen.
So it's that whole like thing that happens to so many women, but we're not discussing it.
Oh my gosh, so many things.
She's like, so
many things. Literally, part of the reason that I even decided to do this is because my own personal story. I went to the doctor maybe 2 months ago, and I was having like chronic UTIs, and she was like, why haven't you come here beforehand? And I was like, oh, I just thought it was common. Like, women go through this. It's no big deal. And so I'm telling her how often I have them, and she's like, ma'am.
She did a ma'am. Good for her.
That's not normal. Like, there could be
Yes.
structurally something wrong with you.
Right.
Or, they could be one chronic long one and it can lead into a kidney infection. Like, you need to come back.
I want to
was
high five
like,
that doctor right now.
Listen. And I was like, oh, I guess I'll do better then. I didn't know. And so again, I think it's so important that even if to have those, at least have those conversations with our doctor to allow them to say, oh, nope, don't worry about that. That's actually totally normal. Nothing to be concerned about.
Right.
Or let's sit here and do a little bit more digging. So important.
And just like you said, one, you thought it was normal, but two, I totally understand this. There is a lot of mistrust in the medical community and the patient population, right? So if you think like back historically, I mean, if you really want to take it back like Tuskegee, right? So there are a lot of my patients who will be like, well, I would never tell you if something was wrong or I felt something was wrong because I don't know what you're going to do to me. Right. And furthermore, what you recommend may be bad for my health and you're just trying to trap me. I hear that all the time. And so again, that's my job to reassure and allow patients to release that information and for me to take it and say, okay, well, here's what I would like to do. I need you to feel comfortable in that space and then we can proceed.
Oh my gosh.
Because that's not how medicine used to be. It used to be like, okay, I tell you what to do, you do it, and then look where it got us. So there's a lot of emotional background to fibroids and any women's health issue. And we have to do better as physicians. I mean, I'll just say it, as when you come in, where can I meet you? Physically, but also emotionally and mentally. And it's hard sometimes, but it has to be done, or else you're just not going to get that relationship that you want. So just like you said, open up the discussion. If we're not talking about it, we don't know where we are. Yeah.
So true. So good. One of the things that's been so encouraging to me with having all of my guests, and hopefully for our viewers as well, is knowing that there are doctors out there that we can find that care, that we can have these discussions with, and we feel like it's a safe space.
It should be a safe space. I even tell my patients, if you feel we don't vibe, please go get a second opinion. It will never offend me. It will never offend me because I want you to feel comfortable in the decisions you make for your health because you're your best advocate.
Oh, so good.
Like, why would I be offended? Like, say, like, if you went to a hairstylist and she was like jacking up your hair every time, would you be like, I'm just going to keep going back to her?
And my people-pleasing days, I absolutely would, but I'm trying to do better about that. But it is so empowering for us to hear that that's okay. I don't have to worry about sparing your I'm my best advocate. So advocate for myself. I'm not getting what I want. I'm not getting what I need. I don't feel like we gel. I can move on to someone else.
I've had patients who I'm like their fourth opinion. And at first I'm like, fourth? Wow. But I'm like, so now I've given you this consult. Go home and look over those 4 opinions and go to who you feel is going to do you the best service. So good.
While we're here, we want to talk about servicing your grandmama because it is the holidays. And with the holidays, you got to give gifts to your mama, your daddy, your uncle, your whole family wants a gift. And so I want to tell you about an excellent gift, especially during the holiday season, which is CanvasPeople. You guys already know how we feel about CanvasPeople. You guys have supported us in helping our this space with CanvasPeople on the podcast. So thank you guys so much. They offer beautiful photos and they come in like these, like you can get the tri ones, you can get the single ones. We've showed you the one that we have at our house that's literally in my living room.
I'm gonna have to go have a look.
Oh my gosh, it's beautiful. I love it. It's a great gift. And because of the relationship that you guys have with us and the relationship that CanvasPeople have with us, we're here to offer you a great deal that you guys love. So listen up. Right now, for a limited time, CanvasPeople is offering their popular 11 by 14 photo canvas for free.
Did you say free?
Child, I said free. Ain't nothing better than free. That's right, free. These normally sell for $69.99, but for this week only, you will pay nothing except shipping and handling. You will get your free canvas by texting the word Kevin, that's Kevin, to 484848. Just pay shipping and handling. This offer won't last. Text Kevin, Kevin, to 484848. One more time, Kevin to 484848. Listen, people, get your canvas. It's the holiday season. You know you need to give a gift to somebody. You don't know what to get. You just struggling in your mind. You getting a headache thinking about it. You getting anxiety. Get yourself a canvas. That's all I got to say. Somebody's had a baby. Somebody's getting married. Christmas is coming up. Anniversary's coming up. Get them a canvas. And then you're done.
And done. Wrap. That's a wrap.
She just
gave you your entire Christmas
list. I sure
list.
did, child. Yes. All right. Let's go back to fibroids. Are they hereditary?
Yes.
Oh, they are.
Absolutely, which is why we have the statistic that we are saying 75 to 80% of African American women. So here's the $1 million question, which I hope I can answer.
Okay.
$1 billion question, okay, is why we know they're hereditary, but we have to find that genetic predisposition. So that's where the research is required. But the problem is we need research dollars. So there are two things I want to bring up when we think of research. One, it's a women's health issue and a Black women's issue. So I do feel it gets put to the back burner.
Yeah.
So a lot of research dollars are not allotted to
Sure.
fibroid research. The other thing is I really want women to understand when there are studies that are being done, it is so hard for us to pass that point of being trustful of these studies that are being done, but they're needed because we need patients in order to study why this is a genetic predisposition. So we know that that's a part of it, but it's not the only thing.
Okay.
So when we think of factors that allow women to have more fibroids, or maybe the ones that are bigger that are causing the symptoms, we know that there are things that play into factors such as obesity. Diet is a big part of it, and that's why I have now incorporated wellness into my practice so much, because diet and exercise is such a big part of who we are, how we can be at our best health. So and our longevity. We can't expect to be that best person forever if we're feeding it trash. Did you hear what I said?
Say it again, because I don't think the
if
people in the back heard you.
If we are feeding our bodies trash, they cannot expect to put their body out and have longevity. And I tell patients this all the time. It's almost as if we run our body ragged, and then in our older ages, we're like, hey, can you like show up for me? And it's like, I can't show up for you because you really didn't help me before. So if we put something that our bodies can use later, it's just like investing money. You know, you want it to show up for you later, but you have to put the work in. So we know that diet and exercise plays a big part, because the fibroids cause an inflammatory kind of environment internally, right? And not necessarily that it's bad, you're just walking around like a pile of inflammation. But if we know that there are ways with your diet and exercise to decrease that inflammation, that's where the wellness part comes into fibroids. And so it's not to say, and here's where we go into the information that's on Dr. Google. I love Dr. Google. He's very popular. I don't know where he quite got his medical degree, but he's very popular, right? But the stories that are out there, so I've heard relaxers. If you relax your hair, will you get fibroids? The diet you eat. So there are a lot of things out there that scientifically haven't been proven. But I do advocate for people to live their best lives when we think of diet and exercise and decreasing obesity, to decrease some of those factors. But it can't be the one and only thing. So if you can't be all vegan, expect to never have fibroids.
Right.
Yes. So just making sure that you find that balance of how you can live holistically in your best way, and not have this expectation that because I cut out all red meat and no eggs and no dairy, I'm never going to have a fibroid, because we know that genetics play a big part of that.
So then the question is there, I think this was so good, and I want to recap because I want to make sure people heard that what you're actually saying is our bodies are nuanced. And so what may work for someone else may not work for you. So figure out what does work for you to the best of your ability, and then maybe your symptoms decrease and this person doesn't, but you figured out what works for you.
Absolutely. I've had patients who have heavy bleeding, again, most common symptom of fibroids. And I'm like, you know what? Let's see what we can do from your end as far as a homework side. And some of them are like, I'm gonna do this. I'm gonna start exercising and change my diet. And then they come back and like, my bleeding is not horrific. It's not no bleeding, but I can deal with this. So my quality of life is now better. And those are the things I really reach for, because you can't have heavy bleeding and then no bleeding. Right. If you don't have that so it's that balance. And just to go back to, you know, how people say, well, I'm going to be completely vegan, never get a perm. I've had a patient, and I will never forget her. This is when I used to live in Chicago. She was tall, lean, athletic. She used to like run marathons. She was vegan, never put a perm in her hair. She had one of the biggest fibroids I've ever seen. So she's like sometimes my point of reference of when I'm like, you can have all of those things that you think cause fibroids and yet still show up with a fibroid.
Got you.
Right.
So good. So good. So hereditary. Yes. So good. We talked about the signs and the symptoms. one question that kept coming up. If I'm done bearing children, what are my options to minimize or eradicate the symptoms of fibroids?
This is like, I would say in my practice specifically right now, my sweet spot of patients are exactly those patients.
Oh, nice.
Either one, they don't want kids, and I'm fine with that, or they've had kids and they're done. But they're like, I don't necessarily want to get rid of my uterus, which again, hysterectomy is an option. And it's not necessarily a bad option. Okay. So there are women who are like, I'm done, say bye-bye, and they want it out. And then some who are like, I'm not necessarily ready. So my job is to find you where you are with that decision and present options to you based on depending on where you are.
That's so good. So you're not pushing.
I've had women who come to me and they're like, well, my 33-year-old I had last week who was like, yeah, she hasn't had kids. So I'm like, well, why would someone tell you can only get a hysterectomy? I've heard that very often, especially in the Black community. So I know it's out there. I know it's real. And I find that you have to allow the patient to be where they are. I've had patients who I'm like, why are you keeping this? It is not doing anything for you. And they refuse to have it out. So I have to now provide them options in order for them to keep their uterus, even though inside I'm like, killing me. So we have so many surgical options, which is why I love the surgical part of my practice that allow women to have minimal invasive procedures to help with their fibroids. So I'll give you an example.
I want it.
Acessa. So Acessa is a radiofrequency laser ablation that is done laparoscopically. So that's that minimal invasive surgery that I do that just treats the fibroid. So it treats the fibroid to decrease it in size, to decrease those symptoms, which then allow you to not have those symptoms, but not get rid of your uterus, right?
I got you.
So it's like, women haven't even heard of that. So I'm like, oh my gosh. So I'm all about options. Then there's an endometrial ablation, which you can do inside the cavity of the uterus to help with bleeding and not have to get rid of your uterus. So again, there are probably 5 things. There's an IUD that has progesterone in it. People are scared of IUDs. Learned about that. Did you?
Tell us more. Well, we learned about progesterone, but within our
but the
cycle.
IUD, that progestin IUD is the business. I have one.
Tell us what it does.
So what it does is it's a long-acting form of birth control. Okay. So you place it in the uterus in the office. It is not horrible to place. It's uncomfortable, but not horrible.
I got you.
See the difference? People like to polarize. And you put it in, and the job of the IUD is to, 1, provide contraception, but 2, it emits daily a very small amount of progesterone, which counteracts estrogen and keeps that lining thin so you don't bleed. Did you hear what I said?
And we learned this. We're going to go back really quickly.
Yeah.
If you listen to the episode with the period doctor, that during the phases of your cycle, the uterus
This is your test. Let me see what you know about the cycle.
Building up. At the midpoint, you have ovulation. It's hanging out saying, are we pregnant? Are we pregnant?
Yes.
We're not pregnant. And then it sheds, which is your period. That lining sheds.
So that means that podcast was amazing because look at her explaining the menstrual cycle.
And so what you're saying is what this
it keeps you
IUD,
in a longer state of that buildup that you were explaining. It keeps that down. So there's no tissue that's building. So there's nothing to shed.
So it's almost like, I almost want to say it's almost like getting rid of your period.
Yeah.
Or at least thinning it.
Yeah, so it's thinning the lining. So when your body is getting ready to shed, there's nothing to shed.
Right.
Yeah.
I got it.
So it's like that lawnmower that's always keeping the lawn
That
trimmed.
Was a good analogy. I love a good analogy. That was good. Analogies, I think, are the best way for people to visualize and be
What's
like, that makes sense. I can grab hold of that.
Yep.
I got it. Ooh, that was good. Okay. Ooh. I be liking when all the episodes come together.
But you did good. I mean, you just explained the entire. You could teach a med school class now.
Listen, I did med school for dummies in 4 episodes. Okay, I'm out here. Give me my OBGYN.
We just need to get
name.
you a certificate so we can hang it right there in the back.
Right there in the back. So good. So I love that there are options available for people that don't include a hysterectomy.
Yes,
totally. Because I can understand being emotionally tied to that. Although at this point in my life, I would be like, so listen, take it out,
like juices, right?
Bye.
And just so you know, great question. I think when I ask these questions, why don't you want it out? Because I always want to know so that we have an understanding of why you came to that decision. A lot of them say, but I don't want to lose my hormones. And that's where I'm like, thank God I asked you, because taking out your uterus from a hysterectomy, we don't remove ovaries. Most gynecologists or OBGYNs will not remove ovaries.
Isn't that like a total hysterectomy or something?
No.
Isn't that a different
I'm
word?
so glad you... Thank you. Thank you for that question. So I hear total and partial all the time. But actually that's wrong terminology.
Ooh.
But we started it. Doctor started. I'm like, we started something and now we can't control it.
Now y'all need to re-educate us.
But you have your uterus and then you have your ovaries off to the side. They are not really attached. They're separate organs.
Okay.
So when you go in and do a total hysterectomy, you're taking your uterus and your cervix. That's a total.
Oh.
A partial technically means if you take the uterus and not the cervix.
Oh.
But both of them never took the ovaries. But we assumed total that we were cleaning everything out and taking the ovaries as well when never that was the case. But that's good. Okay. I hear it every week.
That was a myth that has been dispelled that I didn't even know I knew.
Ovaries, let me tell you, they are the powerhouse of the pelvis. Estrogen is like I really feel estrogen is a wonder drug. So when we do take the ovaries, that's when you get menopause. And that's what women are afraid of. But that's not what we're accomplishing when we do a hysterectomy.
Girl, you just dispelled a myth I didn't know I was holding on to. It was a whole lot. I thought that with a hysterectomy meant you were being medically induced into menopause.
Right. I mean, I hear it all the time. But ovaries usually nowadays, and I would say even when I was training in residency, we typically didn't take ovaries unless we needed to. But prior to that, yes, ovaries were taken a lot. And so now we usually try to preserve them unless there's a reason why we should take them. Or if you're getting a hysterectomy and you're like in your 50s or 60s and you already were menopausal. So now you don't even need your ovaries anyway. Right.
Got you. Okay, one more question. So what would be the reason I would need my ovaries removed anyway?
So if
ovarian cancer.
Yes, definitely. We'd be like, take that out. Please, Jesus, take both of them out. Or if you had like a cyst on your ovary that was very big. So just so you know, I know that there are people here who have heard that they have ovarian cysts. That's what our ovaries do. That's their job, to make cysts every month. They're like, we're going to make cysts every month. And then you don't get pregnant. And they're like, oh, bye-bye, cysts. So if you hear that you have an ovarian cyst, that is not a bad thing.
Gotcha.
Your ovary is doing what it's supposed to be doing. What we're concerned about is the size of the cyst or what's in the cyst. So if you have, say, a cyst that keeps coming back and it's very large or ruptured, people have heard of ruptured cysts, that's when it causes pain. So those are reasons we might say, you know what, let's go ahead and take that ovary. The good thing is that Jesus, he's smart, you know.
He is.
He was like, let me go ahead and give you two, so that if you take one, the other one will compensate as if you had two. Just like your kidneys.
Right.
If you lost one, the other one could kind of churn out as if you had two. And lungs. See? Jesus is smart. He's knew.
He's a great engineer.
He's like, let me give you
knowing.
two of them. So if you get rid of one, you still have a working one.
I love that.
Yeah.
Okay, I might have one more question. I think
we should
covered.
do like 10 million questions.
Listen, I think fibroids, we have I've been learning. So does fibroids, or can they affect fertility?
Yes.
Oh, they can.
They can. Now, again, going back to, I'm so glad we started out the segment with that of, if you have fibroids, it does not mean that there's something wrong with you. So there are women who have fibroids and then have a fertility. So I like to call them two separate pillars, meaning as a physician, it's our job to decide if fibroids are impacting your fertility or not, because they're not synonymous. It does not mean if you have fibroids, you have infertility issues. Or if you have fertility issues, that it's due to your fibroids. So that's when I work with infertility specialists. And what we do is we look, imaging, ultrasound or MRI, and decide based on the location and size or amount of fibroids that this woman has, do we think it's going to impact her ability to, one, conceive, so that's a difference, and carry. Because there are two different things. There are some women who have fibroids, but their infertility issue is getting the sperm to the egg or getting, the quality of egg. So that's a fertility issue.
Oh my
but
gosh,
they
I
can
need to
still
do a fertility
carry.
episode is what you just told me.
Yes, absolutely. So then they can carry, but they still have fibroids, or vice versa. They can get pregnant, but they can't carry because of the fibroids. So it really requires a fine-tuned look at it to decide, do we need to take these fibroids out in order for you to be or to conceive? Because I have had many patients who come to me and they're scared and they're like, I have fibroids and I can't get pregnant. And I'm like, based on the location of what I'm looking at, How about you prove to me that you can't get pregnant first before I go and do a major surgery on you? And they're like, okay. Some are a little hesitant, but I have plenty of them who come back and get pregnant and they carry. So, but I have a few who are like, definitely this is impacting your fertility and your ability to carry. Let's take care of these fibroids, and so you can do your fertility portion of your life. Yeah.
That was a dense, rich little segment right there on fibroids. I hope that we answered all of your questions.
Yes.
You've answered questions I didn't know I had. You dispelled some untruths I didn't know I was holding on to. I thought that was a really dense. Y'all should probably listen to that twice.
I think maybe 3. Just just loop it.
Seriously, that was good. Thank you.
You're so welcome.
Yeah, no, thank you so much, because again, that was a huge portion of the questions coming in were on fibroids.
And I hope it reassures women.
I do too.
Because there's so many women out there who have these questions and don't know where to get the answers, or are intimidated when they go to the physician office, or the information they get in the physician office. They're like, I don't even know where to start with that. I don't even know how to digest that. And so then it creates this barrier, and then it prevents them from going to get more information. So there's so much that I'm able to dispel, but also educate and allow them to become their best advocate.
Child, advocate for yourself.
Yes.
Speaking of hormones, did we speak about them? Sure. I want to tell you about my acne-prone skin that I have. It is so terrible, and around that time of the month, child, I always get somebody's breakout somewhere, just because my skin betrays me despite the good and the money that I spend on taking care of it. And so I want to tell you about Bloom. You guys know about Bloom. I use their Meltdown, which is a powerful blend of natural ingredients that take down pimples just like that, honey child. Just
I'm gonna need some Bloom in my life. Is that BLUME?
Yes, ma'am.
Okay.
BLUME. It does not contain harsh chemicals, no benzoyl peroxide, no salicylic acid, sulfates, or parabens. It's vegan and cruelty-free, and it is pregnancy safe. So, child, you can carry, conceive, and do all the things.
And zap your acne.
And zap your acne all at the same time. This sounds like a win-win-win. So if you're interested, you guys know how I feel about this. I've used this over and over. I keep a little tube of this in my bathroom on my vanity because I have acne-prone skin. Right now, our listeners will get 25% off and free shipping. You guys know how I feel about free shipping. It ain't a real good deal unless you get free shipping. When you text HOUR, that's HOUR, to 797979. This is a special offer you can't get anywhere else, and you support our show when you support our sponsors. And by supporting our sponsors, it allows me to have fantastic guests like Dr. Shepard and all of the other guests that we've had this month. When you support our sponsors, it allows us to do different things on the podcast. So thank you so much for considering taking the opportunity to support them and control your acne at the same time. So again, what you're going to do is text HOUR, that's HOUR, to 797979 to get 25% off Meltdown Spot Treatment by Bloom. If you don't love it, return it for a full refund. No questions asked. That's HOUR to 797979. And we're about to jump into the sex portion of this conversation. But before we do, I want to tell you about Lola. They are Lola. A female. I do too. We actually were talking about this before we got on. Lola is a female-founded company. Y'all know how I feel about female-founded anything. With offering a line of organic cotton tampons, pads, liners, and all-natural cleansing wipes. And they have sex products. And we be needing
tell me about those sex products.
The sex products that are gentle on our bodies and won't have us needing to go see our OBGYN
over and
for
over
antibiotics because this didn't do what we thought it was going to do, and now our insides are all jacked up. Lola's subscription is fully customizable. You can choose your mix of products, your absorbency, the number of boxes, the frequency of delivery, and customize it to what makes sense for your life. You can change, skip, or cancel. Kevin has a subscription service to something else, and he's going out of town. I thought you were going to say he had
a subscription to Lola.
This. No, not to Lola, to something else. And he needed to cancel the subscription because he's going out of town tonight. And I was like, these are the factors that people need that allows you to not waste money and waste product and having it just sitting in your house collecting dust where you feel like you want to just forget the whole thing. Yeah. So the fact that you can cancel, skip, or change your the time and frequency of your deliveries is amazing because you can customize it to your lifestyle. Lola is known for its line of period products made with organic cotton. Additionally, it offers sex products made with women in mind. Sex by Lola is a line of gynecologist approved sex health health and wellness products, lubricated condoms, personal lubricants, and cleansing wipes, designed first and foremost with women in mind, because in a patriarchal society, things aren't always created first with us in mind.
Exactly.
The Sex by Lola line is available for subscription. You can add your peer subscription, so everything is conveniently delivered on your ideal schedule. Right now, for 30% off your first month's subscription, all you need to do is visit mylola.com and enter promo code LOVEHOUR30 when you subscribe. Again, you're going to go to mylola.com, enter LOVEHOUR30 when you subscribe, and you will get 30% off your first month's subscription. All right, Dr. Shepherd, girl,
Yes.
we done doing good.
We just have about 5 more hours to get in.
Yes. Okay. Let's talk about, I have like a bunch of questions, but I kind of want to go straight into the sex questions. Like I said.
Let's do it. Dive in.
Yes.
Was
dive
that funny?
in.
Dive
Yes.
in.
I just learned that's Trey Songz, so I'm about to dive in. Number one sex question that I got. Help us women with low libidos.
Yes.
What can I do? What causes it? What?
So
What?
there are 2 reasons which I think affect libido. So one of them is one we were talking about ovaries, right?
Can I take a time? Can you explain to us exactly what libido is?
Yes.
Okay.
Libido, I think that people feel where cups and libido just pours itself in.
Girl, yes.
That's not quite how
Fill
it
up
works.
my libido cup, please.
But libido actually requires homework on our end as well. But I do think societal has taught us that libido is this thing that we just automatically have. But really, there's an intimacy portion, right? A sexual health portion of libido
Preach.
that many times we completely miss. But it's not our fault because we were never taught that, right? So remember we said those segments of life in a woman's, they're like, don't have sex, okay, don't have sex.
Yes.
So when you get to that, a lot of it has to do with menopause.
Yes.
So when you go through, average age of menopause is about 52. So when you get to 52, when you're explaining the menstrual cycle so well, and you're talking about the estrogen going up, and the estrogen at that point is like, sayonara, I'm sorry, you're 52, so I'm going to exit stage left. So it exits stage left over a course of time, but eventually it's like, no more. Now, when I was saying estrogen is like that wonder drug, that's really for women what gives us our drive, our ability to have those desires, I guess you can say. But we also have to tune into intimacy and sexuality much different than we ever thought. So that's why when I think of menopause, I think of it as a transition and a journey, and we shouldn't look at it as, oh my God, my life is horrible now and it's over. But you actually have to change up here
So true.
more than you think. I'm going to quiz you.
Okay.
What is the largest sex organ?
Your mind.
Oh, you got it. Oh, you get a high five.
I teach
Yes.
that.
Yes. And so we're not taught to use
We're
this.
not
And
taught
so
that.
when we get to menopause and our estrogen is gone, in addition to this not being trained, we're like, well, what do I do next?
Girl, we feel
now
flat.
my estrogen is gone and I don't even know how to use my mind as a sex organ.
Yes.
And so we get to this point where now we're completely drained and we just expect it to pick back up. The other thing is that there are a lot of medications that we use that affect libido. So whether you're on maybe some oral contraceptives, so like birth control pills can affect libido. So if you feel like you're younger and you're not menopausal, obviously, because you're on birth control pills, that if that is something that you've noticed a change in, since when you track back, say, what medications am I on that might affect that? So some depression medications can affect libido. So it really is sometimes looking back at what you're taking.
Sure.
Also, what did we talk about? Diet and exercise.
exercise.
So endorphins are a big part of how we feel about ourselves and sexual energy. So you'll find that people who increase their endorphin release, which is people who exercise, do have the ability to, again, have that kind of, I feel like a little buzz. And also, I would say that women don't know this, but we have a level of testosterone. It's just not as much as men. And so men, obviously, because they have a lot of testosterone, we know what that means.
Yes,
Their
they
sex
do.
drive is like really like, they are just wired different, which we can attribute to hormones because
Yes.
they have so much more testosterone. So we have our own little supply of testosterone that also slightly decreases after menopause. So those are things that could be brought back up when we think of estrogen and testosterone in our hormone replacement therapy.
Got it.
Right? So those are things like I do in my office where you can get pellets or you can get it by tablet. There are a lot of, and that's why I'm saying innovation is amazing because women will come to my office with the same complaint. And I'm like, oh my gosh, there's suppositories that release DHEA, which is a form of testosterone, which can help with your libido. You can get your hormone replacement therapy. So it's really structuring where am I in my life, why I might have this issue, what medications am I taking, am I eating right? Am I eating foods, again, that are going to fill that pot of me being at my best health? And then also mentally. Where are you mentally? Because if sex is our largest, if sex is our largest, obviously I talk about sex a lot, but if brain is our largest sex organ, are we really tapping into that? So many of my patients, you know where I send them? Sex therapists. And people think that sex therapists are just for people who have sex addiction. Absolutely not. There are people who need to learn how to, one, be intimate in their relationships. Two, if they've had any issue mentally, emotionally, physically with their health, and now they have to re-enter a sexual relationship, how do they do that? People who've had abuse, sexual abuse in their life, do not know sometimes healthy sex relationships.
So good.
And so I send people to sex therapists a lot because we just don't tap into that.
Oh, so good.
And that affects libido. That was the short answer.
I think that was so good, and it is something that we have talked about on this podcast, and I've talked about it during our live podcast, is that our mind is our biggest sex organ. And while I know that you said it differently and I heard it, that was a little churchy, but I held on to what you just said. I heard it.
She's going to do a
good.
church dance after.
I am. So for those people who are non-menopausal, suggestions would be diet, exercise, see a sex therapist.
Yes.
And when you say intimacy, you're literally talking about the connection between you and your spouse.
How are you communicating during sex? Let me tell you something. Sex is pretty much taught penis insert.
Girl, you are all up in my Love Hour Live.
And I'm like, no. Yeah, but did you know that there's outer course? Did you know that something doesn't always have to be inserted? Vibrators. I talk about vibrators all the time because, one, you can use it in your relationship with your partner, whether that's same sex, whether that's a heterosexual relationship, or whether you don't have a partner at the time, right? And so it's, again, figuring out what you like, what stimulates you, how to stimulate yourself, because there are different ways that you can reach that climax. And so I think that vibrators should be a healthy part of women's lives and men's as well. But, we're talking about women today, even when they're older. So I have a lot of clutching pearls in my wellness visits with my postmenopausal women who are like in their 60s. And I'll be like, how's your sex life? And they're like, did she just ask me about my, she was like, ma'am, I'm just here for my pelvic exam.
Listen, keep the main thing the main thing.
But then I dig. I'm like, well, how many times a week are you having sex? And they're like, ooh, I'm on this. But they can't leave. They're in a paper gown. They're like naked. I'm like, so you're stuck.
So
and then I'll say, do you have a vibrator? And then they're like, Jesus, come and get me from this room. But I just want to start the conversation. And I want them to understand there's so much more to their health that we're not encompassing sexual health, emotional health, but also physical health. It contributes to our physical health. And we have studies. So this is where evidence-based medicine comes in.
I love it.
We know that sex contributes to a healthier life. And people who have healthy sex lives have better overall health. So it is a wellness. It's a wellness topic. Sex. You never knew. You learned today.
I didn't know. That was good. I think that a lot of times as women, when we're thinking about libido, what we often want is the pink Viagra pill.
Yes.
And because that doesn't exist, because it's so different hormonally, our makeup is different, that's not, I don't even know if that will ever be truly an option for us. And so we end up needing to do a lot more work, it feels like, than men do. You can't just pop a Viagra and all is well, and
and we
your soldiers are
have
at attention.
Sex differently. Like, we're more emotional in our sex, and men are very physical. I mean, but it doesn't mean that we're not physical, and when we think of sexual intercourse or intimacy, but we usually base a lot of how we feel about the experience and how it was on our emotions. Men are just like, did I climax? and then they're like, okay, that was good. And you're like, but what? So you have to encompass that part of it as well.
That was good.
And then also, I find that when we think of libido and intimacy, like you were saying, we want that quickness with it. I think we are in a society where we're like quick return, and never have women, if you look at our track record of when they actually studied orgasm, women do this, men do this. So we have to find a way to climb rather than men they peak really quickly.
Right.
But we need that workup, that talking, that sensation, that feeling, that to get to that point where we're going to climax and do it well. I mean, if you're going to do it, you want to do it well, right?
100%.
Right. So I think that we miss that. But again, it's not always our fault because we were never taught that.
So good.
But also we didn't teach men how we play in that sexual relationship. So now it's this misogynistic, penis in, okay, good. All right, thanks.
And that's it.
And that was it. And you're like, oh, well, that wasn't very eventful.
You have just deconstructed, and not every woman. I want to be clear that this is not 100% blanket. Every woman falls into the category of what we're talking about, but there are a lot of women who do. And so deconstructing, because I have felt in my own journey, I'm like, oh my God, this is like so much work. I have to do so much. I don't understand why this is like, give me a pill and like, let's move on. But it's so nice to hear that part of the reason is because when I look at what it takes to get me there, those are the same things that I need to target to get me there. And so you could look at it as a lot more work, but it's just more targeted. It's more, and so I need to do the steps. Like if I feel emotionally connected, if I feel good about myself, if I feel good about my body, if my mind is in the right space, and I can get there, then when I'm not, I need to address those same factors.
Right. Or tuning into that sexual moment. Again, we multitask so much, so a lot of times when we're actually in the moment, we're thinking about
true mindfulness.
Who's gonna pick up the kids tomorrow? I wonder. As you're like literally
so
you know
true.
what I mean? So we're still planning as we're doing, when really you need to. That's what mindfulness has taught me.
Dr. Rachel's episode.
Yes, that is what mindfulness has taught me so much, is to be in that moment. And it's okay to just be in that moment, but you actually have to learn how to extract yourself from the outside factors and be in that moment. And that's been mind-blowing for me. Is mindfulness is like, be in the moment. I mean, obviously there are times when I can't, it's a quickie, whatever, it just needed to happen, and I'm quite fine with that. But there are moments where I'm like, I'm not here in the moment, and so I'm missing out. And so I need to use those techniques, whether it's using a mantra, whether it's music, whether it's pulling out a vibrator. I don't care what it is, but you have to learn mindfulness in order to appreciate that. And I do yoga.
Oh,
Yoga
that was
always
good.
helps. I don't do yoga while I'm having sex, though.
I wasn't sure.
Just
where
a
that was going.
disclaimer in case you're wondering. I just think yoga helps with mindfulness.
I think so too. I need to start doing yoga and just like practicing stillness.
We should have a podcast where we're doing yoga while we're doing the podcast.
Oh my God, I didn't know what you were going to say.
You're like, where is this going? Because we're talking about sex.
Yes.
Do I clutch my pearls now?
Oh my God, that was so good. I just love you right now. You're doing all the things that I didn't know I needed to be the end of this podcast, like this series. You are wrapping it up nicely, because so many of the prior episodes are weaving into this one so nicely.
You planned
giving
well.
me like all the butterflies. I feel really good right now. Our last sponsor for the podcast, really quickly, while we're talking about feeling good and looking good, is Third Love. I'm so freaking excited, because you guys guys know how I feel about Third Love in real life. They're the bra I do not feel the rush to take off at the end of the day. That says a lot because as women, that's the number one thing we want to take off at the end of the day. And I'm even more grateful because I have a book club. It's called the Book Club Booze, and I love the Book Club Booze. We just finished, shout out to you guys, the Boo Hive. We just finished my first giveaway. I'm giving away a huge box with all of these things, and included in the box is a Third Love bra. Woo-hoo. I'm so excited for the winner. And I asked her yesterday, I was like, make sure you go on their website. You're going to take your Fit Finder quiz, answer all the questions. They take into account your breast size, the shape, is it droopy, is it wide, all the factors. And then they give you a recommendation based on the way you answer the questions to say this is the size that most appropriate will fit you. Because as women, we be out here thinking we know, and we be having gaps in our bras, our shoulders hurt, this back here hurts, we have indentations, we have bras that are uncomfortable and don't fit right because we don't know what we're doing. And so Third Love has decided, let me help y'all as a population do this quiz, answer these questions, and we can more better assess what will be your bra size and make sure that the girls are just like Jesus, high and lifted up. Over 14.
She is in timeout right now.
I just believe they should be the same. Third Love offers more than 80 sizes, including their signature half cup sizes. Skip the trip, find the fit. Child, that was a whole tagline. Skip the trip, find the fit. With Third Love's online fit finder, order and try them at home. No more awkward fitting room experiences. Over 14 million women have taken the quiz to date. That's today when you listen it. It's actually really fun and really easy. It's very simple. Every customer has 60 days to wear it, wash it, and put it to the test, the bra. And if you don't love it, return it, and Third Love will wash it and donate it to a woman in need.
Gosh, I love that.
Me too. That's actually my favorite. We've had really good sponsors for today's episode because they like weave in really good. But all the ones that are like here for women empowerment, I'm here for you too.
Did you know, like, I felt like I had learned something about the universe when I heard that you need to be fitted for a bra?
You do, people.
And then I had it done and I was like, well, why didn't I know this about 30 years ago?
See, don't be out here thinking you know and don't know.
Yes.
Get fitted.
You need
ma'ams.
to be fitted for your bra.
Ma'ams, get fitted.
So they're high and lifted up.
High
I'm
and
use that
lifted
one
up.
all the time now.
Third Love knows there's a perfect bra for everyone, even you, the person with the most uncomfortable bra. So right now, they're offering my listeners 15% off your first order. Go to thirdlove.com/lovehour now to find your perfect fitting bra and get 15% off your first purchase. That's thirdlove.com/lovehour for 15% off. Go there today. Tag me in your post because ain't no way in the world you not gonna like these bras. Okay, I just dare you to not like them. First of all, Dr. Shepherd, I love you. I love
you
this.
too.
I just feel like this is like
we're in a love hour relationship.
We
now.
are. I just feel like this was such a great conversation. I've learned so much. And again, I just feel like it was the perfect ending to this series.
Yeah. I'm so glad you did this. You like committed and really went out and said, I'm going to help women. And over the course of a month. So you didn't just like do one. You just did it over the course of a month. And look at us today.
Look at us today answering all of all of my questions. Okay. All right. We're going to finish the sex portion. We're going to end with the current event one, but I'll get there.
Yes.
One question that comes up a lot is vaginal dryness.
Ooh,
and
yes.
we talked about this a little bit with the period doctor, Dr. Chambers.
Yes.
And it came up again. So I don't know maybe you can answer and I'll try to think about what I feel like was missing in that. But a lot of women experience vaginal dryness. And actually there's like two sides. A lot of women are either experiencing vaginal dryness or people feel like they have excessive
lubrication.
Thank you. Lubrication. Yes. So first one, what can we do to minimize dryness without lube was one of the questions.
Okay.
She said, is it my diet? Is it something else? Like, what can we do?
Let's start out and I'm going to tell you what I think of the vagina.
Okay.
It's a canal.
Yes.
Just so you know. Yes, it's a canal.
And it's irrigated. I think that's the correct term.
You know what? We need your diploma here right now to hang on the back.
Send it to me, Melissa Fredericks, FREDERICS.
You're going to see it in the back next episode. But the vagina is like I call it a tube sock. So if you had a tube and it has a blind ending, at that top is the cervix.
Yes.
And the entire sock is the vagina.
Okay.
It's a canal. And it's like...
That was a good...
Yes, analogy. Analogies help me too. And it's like a wine cellar. A wine cellar, in order to keep wine where you need it, you have to have it at a certain temperature, right? So you don't walk into a wine cellar and it's like completely cold or completely hot, right? It's just that right temperature. The vagina pH, I'm sure you've discussed that, is very important. Yes. And so when that pH is shifted, that's
4.5,
when...
4.2 or 4.2,
I'm done here.
4.5.
I'm wrapping up because she just... But yes, that's the pH. And so anytime it shifted, just like Dr. King said, is when you might have your yeast infections and your bacterial vaginosis. So that's a vaginitis infection issue. Okay. And just so you know, yeast infections and bacterial vaginosis are not STDs. They are not sexually transmitted. It has to do with the wine cellar effect and the pH. So women who...
So in your analogy, the wine cellar, the temperature is the pH balance.
Yes.
Got you.
Yes. And so you want to maintain that pH, and those can be affected by... So for example, when you brought up someone who has a lube issue, one, I'm very much for lube. I think people think that it's like an old woman thing. No, slap that lube on, okay? Use it liberally. I mean, it should be all over the place when you're using it. If you're going to use it, and do not be ashamed to use lube.
That's good. That's probably part of this, is that we feel shame using
Why?
it, like our bodies aren't
you know where that came
right.
from. That came from the porn industry. And so the porn industry suggested to both men and women that if it's not super lubricated and it's not flying all over the place from like natural secretions, then something's wrong with you. But that's actually not true.
Got you.
And so lube is okay to use, but some people who use lube, actually it changes their pH. Most women, I would say, are not affected by lube, but there are some that are. Okay. So that's when they would... What was the brand that you brought up?
Lola!
Yes. So those types...
So when they say with females in mind, that's what they're talking...
Oh! They are actually tuning into the products that they found in other lubricants that were causing a shift in the pH, and they were like, let's take some of those out.
Full circle moments happening here.
And so now that women who had those issues before can use some of those other lubricants that are naturally based and not have that pH shift.
Got you.
Yes. So that's like a whole vaginal infection issue, which
that
is, again,
good.
not STDs. Yeast and BV, pH issues. So then you have women who have vaginal dryness. Again, women should not be ashamed if they have it, because we have younger women who have vaginal dryness issues. Most women who have it, a menopausal issue, because of that estrogen, the wonder drug is gone, and it dries up the tissue, and your vagina is like, help me, right? So that's why women, usually menopausal, I'll say try lube, see how it works. But there are so many things to fix that rugated tissue, as you said, which now becomes flat. In menopause, so it creates that fragile tissue.
Hold on.
Yes,
hold on.
You're getting a moment.
Yeah, I am.
Yes.
Okay, so rugated means that it has like these
indentations.
Yes. Thank you. And so is estrogen what's causing that?
Yes, it contributes to the ability for your tissue to do that. It creates the collagen factors, the growth factors that allows it to be that nice tissue that is flexible, which is why it's like that, because when you bear a child, it allows it to stretch and come back. You. See, Jesus was smart. He's like, let me like that vagina rugated.
Oh, I love it.
So at menopause, obviously, if estrogen is not there, you're not having children. The tissue becomes flat, and therefore, during intercourse, it can become dry, irritated, fragile, and that's when you have the pain during sex. So lube is one, but there are things in technology that we can do. So I do in my office. So hormone replacement therapy helps with that estrogen, getting that back. But in order to get those growth factors and collagen, I do vaginal rejuvenation.
Ooh.
So that's like using...
Someone asked that. Tell me.
Yes. So I love vaginal rejuvenation. It is like game changing, because what it does is it allows, like, we use a laser. You can use CO2 laser. You can use radio frequency as the technology. But we insert a wand into the vagina. And we basically penetrate through very small micro like arrays of this energy and heat to get to that basement membrane of the vagina to allow the collagen to come back. So it's almost as if like it shocks it, it wakes it up. It's like, hey, collagen, remember? And it recruits its friends. It's like, hey guys, collagen, we're supposed to be doing something. And it brings it back to the neighborhood, gets in the wine cellar and the canal, and allows the tissue to respond as if you were premenopausal. So the secretions increase. A lot of women who have urinary leakage will notice that they will have resolution, or again, improving that, because we're getting the tissue We're increasing the resistance and the flexibility of the tissue so they're not having these issues.
Okay, so when you just said this, I don't know if this is accurate, but I'm gonna tell you what my mind thought of: a facial.
She needs her degree. Right?
Listen,
Seriously.
give it to me.
Do you know when women come in my office and they are like a little bit hesitant or like, you want to do what to my vagina? I say, bring it up to your face. That is exact. Did you stop mind reading?
I promise you, the only reason why is because I get facials pretty regularly because I'm acne prone. And one of the things that they do when they do the like radio frequency, or I don't know if that's actually the right word. Okay.
It is.
And they're stimulating your skin. It produces collagen. It's making your skin, it's doing all the things that you were just talking about in your vagina.
So basically I'm not even needed here because she just explained everything. I bring it right back up to face. I say when people go and we get older, what does our skin do? It sags. Our natural fat pads in our face start to sag. So that's why you get, the hollows in your eyes. And so when we use radio frequency or even CO2 on your face, it's to stimulate the collagen, which allows it to retain water. So it hydrates it. It pulls back the collagen. We just brought that technology to the vagina. So just like people would run to go rejuvenate their face and make the collagen come back and restore and hydrate and hold the water, it's the same thing we do in the vaginal space and bring it from here to here.
I got it.
Yes. And so that allows people to make that connection. They're like, oh, it's the same technology. We just changed a few things on it and allowed it to affect the vaginal tissue the way that it affects face. So you just made that really easy for me. Thank you. Radiofrequency CO2, vaginal rejuvenation. Carboxy gel treatment is new. It's on the market. So carboxy gel is, again, something that they used to do with face. Okay. So they do this in Japan on your face. So carboxy CO2 treatment, which is carbon dioxide.
I did know that.
If you apply it to tissue in humans, it activates oxygen to bring oxygen to the face. Because
oxygen and carbon, they bind.
And so now we've applied that technology with the CO2 Lift for V. Okay. And that is a product I will actually send you.
Please do.
A CO2 Lift V, which now we take carboxy gel treatment and apply it to the vaginal tissue and does the same technology. Look at Jesus.
Ain't he good?
He is good today.
Shall do the rejuvenation.
Yes. And so what's another thing that they do on face?
Tell us.
Vampire facial.
Oh, I don't know this.
So this is when we draw blood from you. Yes. I do. And we spin it down and we take all that plasma-rich platelets off of the blood.
I have heard of
and
this.
put it right back into your face. We do the same thing in the vagina. And
Are these invasive? Injections. They don't sound very invasive.
No, they're not. They're office procedures. Not a lot of downtime. People can come on their lunch and get it done.
Oh, wow.
So the O shot, so that's good for kind of stimulation during sex. We can inject that same PRP into the clitoris. Yes, we can. But we can also inject it in the vaginal tissue to do the same thing, restore and use your own blood supply and your plasma to bring all that stuff back to the vagina.
People probably like that because they don't feel like it's not bringing in something that's foreign to their bodies.
And do you see what options?
Yes.
We just listed options.
Yeah, you did.
And that's what people need to realize is that there's so many options out there, but you just need to discuss them and find what's best for you.
I want you to be in LA. Can people
I'm moving
do
everyone.
This?
I'm moving to LA.
I want you to be my doctor. Can you do these things and not be menopausal?
Yes.
Okay, because
yes. So radio frequency, because you brought that up yourself, because you're just so smart and I really shouldn't be here.
No, but I need you, child. I do need you. But I get facials all the time, so that's the connection I was making.
Radio frequency is a little bit different than CO2 because it's more tightening, right? So when people want like a tightening effect on their face, so for patients women who have had like children and they feel their vagina is a little lax, radio frequency vaginal rejuvenation is really good because it tightens. You could even do, this is like mind-blowing deep. You can even do what we call like a labiaplasty, which is when you make your labia a little bit firmer and tighter with radio frequency.
Why would you need to do that?
Because some people they don't like the way their vagina looks
externally. Okay, this is like cosmetic.
Yeah, this is cosmetic.
Okay.
And so for menopause, same thing, face sagging, same thing that happens in the vaginal space. So they might come and say either I've had a lot of children and my, labia are sagging a little bit, or they're older, so they have that little bit of laxity in their skin down there, and we can rejuvenate that and plump it up and make it tight. In office. Done.
Did you know that this was a thing? Joshua.
Why are you asking me?
He's still his jaws
Did
dropped.
you know?
I knew that you could. I didn't know the details of everything, but I knew that there was construction.
She said there's construction things going on, like a hard hat and everything.
Right.
Mm-hmm.
Exactly.
I didn't know. I just was today years old.
All of these are done in office. Everything that I've listed is in office. The carboxy gel treatment, you can do at home. So that's something that you, like when I send it to you, you would take it home and do. You don't, Kev doesn't even need to do it for you. You can do it yourself.
Even better, child.
DIY.
I love it. Okay, so I have one more question then about this. Is this specialized? Like, can we go to, not we, but our audience generally, we're everywhere. Is this a procedure that most OBGYNs would offer, or would you? No.
Not most.
I knew it. I knew you was a special good one.
But I wouldn't say they're hard to find, but you will find GYNs who will, very outwardly say, we do these procedures in our office.
Like advertise that.
Absolutely. Yeah. So if you, because everyone's on social media nowadays, right? So you can I usually think that Instagram is a great way to find people who do it. So if you typed in vaginal rejuvenation as a hashtag, or any of the treatments that I mentioned, usually the doctors that do it know, and then they'll tag that. So that's a great way to find it. But if you are in Dallas, Texas,
come on and tell us.
Come on and see me, because I will do all of those things in office.
Oh my gosh, you are fabulous.
We're going to, construct the vagina?
You were going to do the chat.
Construct.
I love it. Okay, last question we're going to end on. So there's a video that has been going around
do tell.
the social media universe of a particular pastor.
We're not going to say what Kev said.
We won't say what Kev said. And he was, shut up. And he was giving cunnilingus, okay? And I'm trying to be good here. And he was doing it from, follow me, front to back, and then back to front. So the action was going both ways.
Right.
Okay, follow. And so sexologist Shamira, she was a guest on our podcast, love her, was talking about the risk of bacterial vaginosis, which we just learned is not an STD.
Yes.
So tell us, number one, what is bacterial vaginosis, and maybe the correct way to give vaginosis, to give cunnilingus, so that we are not at risk for infection.
Yes. So basically what Shamira was explaining is, now it's the same thing you learn when you learn to wipe, right? As a female, you do front to back and not back to front. Because if you think of the proximity of the vaginal opening and the urethra and the anus, right? They're in very close proximity, but we do know...
I don't know this anatomy, so okay.
Yeah, so women, we have 3 holes, everyone. 3, not 2. And so really what we're trying to do is prevent anal bacteria from coming vaginally or even to the urethra, because that's how you can get a UTI.
Got it.
And creating... So it's just... They're different spaces. They like each other, these spaces. But sometimes if they come in too close proximity as far as their bacteria, there are bacteria that are native to the anal tract and not to the vaginal space.
I got you.
So what happens is when we're talking about that wine cellar, so some of that bacteria might get into the wine cellar and set everything off, and then you get a bacterial vaginosis. So bacterial vaginosis, if we were to think of like a term, a actual definition, is when you have the normal cells that are in your flora of the vagina.
Okay.
And what happens is something shifts that, whether it's because you used lube that's not good for your vaginal space, or a condom. Some people are very sensitive to condoms. Or if you have now a bacteria that was in that area and is now in the vaginal space, it sets the pH off.
Got you.
And then it creates like a playground for that already native bacteria in the vagina to overgrow. Literally, they have a house party. That's what they do.
I got you.
They basically are like, oh, you want to change the pH? Okay, we're going to go wild in here. And so they overgrow. And the job so that's what sets off that odor, is because that's an amine odor, and that's what is the pH balance is shifted. So when women come to us, all our job really to do...
Wait, what type of order did you...
Amine. Some people say amine,
which means...
It's just a nitrogen.
Like ammonia?
Yes.
Oh, okay.
Look at you. She's already did the chemistry portion of what I just said.
I was trying to make... I was struggling.
Yes. So it's that odor that comes off that's nitrogen based, and it's basically the ammonia.
Okay.
Right? And so again, this is all natural. It's just the symptom that we get is very annoying. and
Yes, it is.
frustrating. So that's what our job as gynecologists to do, is to shift that pH back so it corrects everything, and that excess bacteria that was supposed to be there, we just basically tell the party
Y'all gotta
about,
go home.
yeah, some of y'all gotta go home because there's too many people. The fire hazard, fire marshal's gonna show up because there's too many people in here. And so once we shift it back, that's when you get to the correct pH. That's when you're fine.
That was great. When you are experience BV,
Yeah.
because it sounds like then you can get it from licking back and forth,
Yeah.
or from sex, just
Yes.
from the natural.
From
because
normal
we talked
sex.
about the vagina being acidic,
Yes.
and semen being alkaline,
Yes.
and so that's going to disrupt the pH.
It can.
So then, what do you are now? Your pH is all out of whack. You smell like ammonia. What are some things that you can do? Do you have to go to the doctor and get?
You don't.
Okay.
I think that there are women who, there are things that don't shift their pH. So when it happens, we can correct it with, one treatment, whether it's a daily treatment for 7 days. We can do a gel that you can insert for 5 days. You can also there's a new medication that you can take as a granule form, and you put it in applesauce or pudding.
Got you.
And so it's all done to set the pH back. There are women who have what we call chronic BV. And we usually specify that as if you have 4 episodes or more per year. That's when we kind of have to train the vaginal pH to be better. We're like, can you do better? So we usually put them on a longer regimen, and then monthly we'll put them on 1 tablet or the one-time dosage of the granules, because we really want that pH to remember. So it's every month you're like, remember, you're supposed to,
Gotcha.
I'm gonna check you. But we also want women to know their triggers. What are they eating?
Yes.
A lot of my women, if you're diabetic, this goes to overall health and how it can affect vaginal health.
Okay.
So women who are diabetic, who don't control their sugars, will have a lot of BV and yeast infections.
Control the sugar. So meaning you need to minimize your sugar intake.
Right. So when they do their sugar draws and they're not taking their
Got you.
medications, and so their sugar is consistently high, that actually messes with the pH of the vagina. And many women will come to me with chronic BV or yeast because they're not controlling their sugars.
Got you.
So that's a diet thing. Then you have women who some things just set it off, whether they're the person they're with, the semen sets it off, which is fine. That is not a bad problem. We just have to know what that trigger is so we can control it.
Sure.
Or using certain condoms. So there are different things that can have women fall into that category of chronic BV or yeast versus if you're episodic. What woman has not had an episode of yeast or BV in their life?
Right.
And that's fine because we can correct it.
Got it.
When it starts to become chronic that
okay.
it's annoying.
And you're saying more than 4 in a year.
Yeah. So we'll have women who'll be like, every time I have a period. There are women who have every time, because that blood is shifting the pH.
We learned that.
Yes. So those are women who notice it every time they have their period, or they're like, every 3 months, I just have this BV. So we just need to pay better attention to them. That's where I think that women can be a better advocate for themselves, is find a GYN who's like, you have chronic BV, let's start a different regimen for you. Because what happens is they get treated every time they have one, and then they're taking medication every time they
Right.
get one. That's not fun.
No, it's not.
So lifestyle things, and also finding someone who can help you change it from a chronic issue to maybe just once or twice a year. That's success to me.
Yeah, it is.
If you're not
Okay.
getting it every month.
And so I know some of the things that I have read is urinating after sex can help.
Yep.
Does cranberry actually help?
So I've done a lot of actual articles about this and TV episodes. There is
Credentials.
is that women will be like, oh my gosh, I have a UTI, I'm going to drink a ton of cranberry juice. The caveat with that is that, yes, it helps, but when they were doing studies, they use usually natural cranberry juice, which does not taste like your maybe ocean spray cranberry
The
juice.
cocktail.
Because it has a ton of sugar in it. So then you're kind of pouring all that sugar back. You're like, here, let me put all this sugar back into my body. So really water is going to help flush out that bacteria for UTI. Yes, cranberry can help. Usually it may be in the form of a pill. Or natural cranberry juice, because it's not sugar loaded.
Got you.
So just make sure you do
Super tart. It's
that.
gonna make you weak right here.
Yeah. So yeah.
Okay, so that was good. So water, I have noticed that I am more prone to, I thought they were UTIs and now I'm like, maybe they were BVs. I'm not, I feel like I need to.
they're in the same neighborhood.
Okay, yeah. I'd be like, I don't know now. I got all this information. I thought I knew. I don't know now. But I've noticed that if I am more on the dehydrated, which usually is brought on if I'm like, I'm going to have wine every day.
Right.
And so I get dehydrated, I am more prone to BV. So I feel like that's my personal testimony. So I feel like my hydration
has a lot to do with it. So if I feel that you should not decrease your wine intake. I'm going to co-sign on that.
Help me then.
I will challenge you when you drink wine to drink like a 2-to-1 ratio. Two glasses of water to a glass of wine.
Darn, I was hoping you was going to say 2 glasses of wine.
No, ma'am.
To 1 glass
She
of
tried
water.
it. She tried it, but no,
did.
that's not the ratio. Do you
Let's be
want
clear.
your degree or not?
Listen, you gonna hold it back for a glass of wine? I want the wine.
So it's kind of like you're like, okay, I can have this wine, but I'm going to make sure I hydrate myself after. So that give your kidneys a chance to filtrate, give them some water, help them out.
I'm here for it.
Okay, thank you.
I'm
Can we go back quickly to that social media?
Yes.
Thing is that here's what I didn't watch the video, but I've heard lots about the video. One, I think that it should not detract from the fact that oral sex is bad. Right? I think all the other things that came around it and who did it and where they did it, whatever. But oral sex is very healthy. Okay, so that should not detract from it. Now, I do agree with the front to back to front thing, but I don't necessarily want people to be like, oh my gosh, okay, wait, stop what you're doing. Okay, wait, can we go from like front to back? Okay, wait. Don't take
Moving
from the
all
nude.
of your head. Excuse me, 1 lick. That's it.
Right.
None of this.
And then we're done.
And
okay.
I
And
don't
make sure
need
you
no
go
BBs.
from. I mean, that. Could you imagine that? I would want.
That's going to take
I
away
do
from
not.
mindfulness.
Right. Exactly. So that would ruin the whole sex episode. But I think if that were to happen, if they're like, oh, maybe so then, like you said, urinate after, and then maybe take a bath and don't be excessive. Please, women, stop like putting like detergent and bleach up your vaginal canal. Okay. All right.
No douching, none of that.
No, like stop it. So it doesn't mean you like run to the bathroom and again ruin the moment with like I gotta pee and like shove some bleach up my vagina. Stop it. Just maybe politely say, I'm gonna go tinkle. You know, like still make it sexy. I'm just gonna go tinkle, and then maybe like wipe with a wipe. One of the wipes you mentioned. See how I brought that back in?
Yes, child, you're excellent.
And when you wipe from front to back. Okay, we're gonna learn a lot today. And also just maybe like use excess water to kind of just clear out the area. Right. So I do think that 1, we can use that as a learning lesson. But 2, like don't take away from that you can't have oral sex. And now if it goes from back to front, then you just ruin. No, just still be sexy about it. Be like, excuse me, I'm going to go use the bathroom.
Hair flip, mama.
Yes. And then don't be shoving bleach and detergent up your vagina in the bathroom. No, just small little wipe with your Lola wipes.
Oh. This has been fantastical. I'm just like on cloud 9.
And you got a degree at the end.
I did.
I mean, what better way to end a podcast?
I hope that we have answered all of your questions.
Yes.
This has been most informative and informational and helpful and empowering and just all of the things that I needed it to be. Thank you so much.
You are so welcome.
So much. I'm just like
she's bubbling.
I am bubbling. So I want to end, of course, with allowing people to follow you. All the people that have been on the podcast have gotten, I feel like, at least 700 to 1,000 new followers. So thank you guys for supporting my guests. So please tell the people where they can find you. Again, your practice and all of the things.
Yeah. So obviously, I am in Dallas, Texas. But my practice there, so even if you're anywhere and I have patients who fly in for certain surgeries or vaginal rejuvenation, Dallas, Texas. But on Instagram, I am Jessica Shepard, MD. That's JESSICASHEPHERD, MD. And I'm also Dallas Gynecologist on IG. So I do a lot of like my IG stories.
I
going
don't follow
over.
you on Dallas.
Yeah, it's not as like out there. It has a
Okay.
lot to do more with the sexual health, but that's where I'll answer like a lot more sexual health questions. I really focus on that. And I really, if people DM me questions, I will try to answer those in stories.
nice.
And I will not name you.
Right.
I will address the question. On Twitter, I am a little bit angry on Twitter. It's a little bit political, but I still do focus on women's health on Twitter. And that's J Shepherd _MD. So that's JSHEPHERD _MD. And to my women out there who have probably helped me as far as like being in social media and media, I started out on Facebook. And I started out on Facebook on Her Viewpoint. So Her Viewpoint was my initial like kind of launch into I want to help women and address them and their issues. So Her Viewpoint community on Facebook is really kind of like my baby, where I started all of this. And that's where I post a lot of like Facebook lives or like articles that are helpful for women to know what the actual science is behind, but it's not like overwhelming.
Yeah.
And that's where I house a lot of like content for actual information on Facebook. So Her Viewpoint community. So those are my 3 platforms.
Oh, that's great. I'd
Yes.
highly recommend that you guys follow Dr. Shepherd, and especially on Facebook, because articles and
Yes.
all of that information in formats that are digestible,
Yes.
information that you'll hold on to and keep and remember, so you don't feel helpless, because having chronic BVs and feeling like there's nothing I can do about it.
I
But you've
know.
given us tips and tricks on
Yeah.
BVs and sex and fibro. I mean, you've given us so much information that is more than just head knowledge. You've given us things that we can take in our everyday lives to make our bodies work so we can live
Tube
our best
socks
life.
and wine cellars
Girl,
and
everything.
all sorts of things.
I love it. Thank you again
Thank
so
you for having me.
much. I'm so excited.
Honored and humbled to be here. And I think your audience is very like, they are very good to have someone like you who advocates for them and listens. Because I mean, even when I came in this morning, you're like, I got more questions, and people were, so people want to hear from you. And I'm glad that I was able to use your platform and your vision to get this information to women.
Thank you.
Yes, thank you.
You were just so great. I want to cry. Thank you guys so much for joining us. This is the last episode of the For Women Only series. This was my soft launch, but we'll be doing this again next year. I just got to figure out new topics. So send them to me if you have some at hello@thelovehour.com. Okay. Also, last minute announcements. We have the Love Hour conference coming up July 9th, 10th, and 11th in Atlanta, Georgia. Tickets are still available. If you are single, you were not forgotten about. I did not forget about you. Please go get your tickets, thelovehour.com. Look at all the speakers. They're amazing. We have a pajama jam for women with amazing speakers, and it will be a great time. It'll be fun. It'll be a blast. We also have the Plus One coming up in Charlotte. We know that you're tired of going to the same date nights, just doing dinner, just doing the same thing over and over and over and over again. I'm sick of doing it. That's why I was like, we need to do something different. So what am I doing? A date night, curated. I'm taking on all the planning. The first one will be a murder mystery dinner, Christmas murder mystery dinner. It's going to be so much fun.
That's cool.
Dinner is included in your ticket. A good time is included in your ticket. Joshua will be there. He's included in your ticket. You can bring your plus one, whether that's your spouse, your partner, your friend, your girlfriend, your boyfriend, or if you want to go alone, feel free. You can be me and Kevin's plus one. The link to buy tickets is in the bio. We're almost 50% sold out. Make sure you buy your tickets. And I think that's it. Until the next time. Bye.